Sherman.
Thank you, Chief. As always, I want to begin by sharing my condolences to the families who have lost loved ones. We now know that we have 131 citizens of Dougherty County that have lost their lives, and we share in each of the family's sorrow, and we pray for you every single day. While we find ourselves in the wake of some very tragic happenings, some very tragic loss of life, there is hope, and we have done a lot of very good work here in this community to combat the virus and its impact. And I'm very, very pleased to be here today to announce that we have continued to flatten the curve here in Dougherty County. We have seen the rate of infection greatly decrease from rates that were frankly astronomical at the very beginning of the injection of this virus into our community under circumstances that frankly I don't think many other communities could have recovered from as quickly as we have. And we know certain things. What we have been doing is working. We need to continue to do those things that we have been doing, continuing to follow the rules that are in place, continue to be careful, continue to wash our hands, continue to mask up, continue to social distance. Now, we know that there are certain rules that are in place from the governor's order that have changed, and we're going to go through a process as we move through the COVID-19 virus experience. We know that on the initial, from the scientists, from the doctors, from the epidemiologists, from the researchers, that there are certain stages to this process. We've been through what is phase one, which is the initial injection of the virus into our community, where unfortunately in this community it infected a large number of people very quickly and caused a catastrophic number of losses in terms of loss of life. We have successfully moved through phase one, and we have flattened the curve, and that's a tremendous accomplishment for this community, and it's a testament to the hard work that has been performed by our healthcare professionals, by each and every single member of the first responders, the coroner, law enforcement, each member of the task force, people that are from the medical community, people that are from the school system, people that are from economic development, people that are with the city and the county. All of these people have worked hard towards one goal, and that is to keep more and more citizens safe. And I want to say thank you to each of those members who have been on the front lines of helping us flatten the curve and lower the overall death rate. Just before I came in here to speak today, I wanted to confirm with the coroner that we have only had a few losses of life here recently. Whereas when I stood here several weeks ago and the coroner stood here several weeks ago, we were losing people every single day, again and again and again and again. And what I want everyone to understand, appreciate, and imagine is this. The number of people that the coroner is having to go and visit and inform them that a family member has passed has greatly reduced. And that is a very, very important and impactful result that our actions have taken, and this community's actions have taken. And I want to talk about the rules that are going to be in place for how we move forward in the context of how we've been applying those rules. So the governor issued a new order, and it went into effect here recently. It was released on Tuesday afternoon. Under the governor's most recent executive order, the gatherings rule remains in place and allows 10 or fewer people who are non-cohabitants to gather in a single location without maintaining social distancing. Now, what I say to each of you, that means 10 people can get together and have dinner. 10 people can get together and watch a movie. 10 people can get together and play Monopoly. 10 people can get together and play a game of basketball. And they don't have to social distance. What I would say is it's a personal decision. It's a personal choice as to how you may or may not do that. Use good common sense and understand this. There's still significant number of people in Albany, Dougherty County, and Southwest Georgia that have the virus. Many do not know that they have it. What is important for us in particular is that it appears that we have arrested its growth significantly, not permanently, because you can't arrest the growth of a virus permanently absent there being a vaccine. But we have arrested its growth significantly as it relates to our most vulnerable citizens. Who are our most vulnerable citizens? Those that are elderly and medically fragile. And again, those citizens are still required and suggested, and we encourage them to continue to shelter in place until June 12th. And in fact, that's what the governor's order says, that you are, if you are within that population, to continue to shelter in place. Why is that? Because there's still a significant number of people in the community that have the virus, and we know that those that are medically fragile, those that are elderly, those that meet the definitions that have been released as medically fragile or elderly, are the most likely to suffer an adverse consequence, the most likely to potentially lose their life. And as we've said again and again and again, one life is too many. And we don't want the coroner having to visit anyone else. And that may continue to happen, but we very much want to continue to lower the number of visits that Mr. Fowler has to make to different families in this community to inform them that they have in fact lost a loved one. The order that is currently in effect will be in effect until midnight on May 31st. As I said before, the shelter in place for the elderly and the medically fragile remains in effect through June 12th. You can find a copy of the most recent order on our county website at darty.ga.us under the public notices link. Again, that's darty.ga.us. Go to the public notices link, click on it, and you can find a copy of the order if you wish to read it. Again, we appreciate our local churches continuing to make decisions that are based upon their congregation's needs and the makeup of their various different congregations. We know that some churches have larger numbers of elderly and medically fragile parishioners, and those churches have been very encouraged to see they're making decisions based upon their congregation's needs as to whether or not to go ahead and to continue physical services in place at the actual church. Again, we have released information that is available for churches so that they can make decisions if they decide to move forward with holding services on site, how best to protect everyone. And again, I want to say this, we have continued to work, the city and the county, to mask up as many citizens as we can. We're very thankful to Phoebe and the many other sponsors who have provided masks at no cost so that we can continue to proliferate masks into the community so that more and more people can wear a mask. If you're in a situation where you need to go out in public, I am saying this, please wear a mask. Even if you can maintain social distancing and you're in a public area that is frequented by a lot of people, please wear a mask. Now, when we're done here, someone's going to come here and sanitize this area. If you go to a grocery store, I want you to think and imagine and understand that, like, if you're not wearing a mask and you cough and you have the virus, you can actually transmit that virus to a surface, whether it's got Capri Suns, a can of beans, chicken, or what have you, and someone else may pick that up and become infected. And so when I say wear a mask, it's not just for your protection, but it's also for the protection of each and every citizen that is in the community. Additionally, we have some new information that has come in from the Department of Public Health that we will be getting out and hopefully be getting better updates regarding COVID-19 related illnesses that do affect pediatric patients, that do affect children. We've seen some of this in the New York area. There have been, I think, approximately 70 to 75 cases of this COVID-19 related illness that affects children. Some it affects seriously, some it doesn't affect us seriously, but it is significant. And we've gotten this information recently from the Department of Public Health. We're going to be getting that information out to the public so that our citizens know what to look for in the event that we have a proliferation, a growing and infections amongst children, because thus far we really haven't seen it amongst our children. And obviously the children are our future, and we want to make sure that they are as protected as possible. So please be on the lookout for that information as well. Again, please continue to mask up. I see, and I want to say this. It's a complicated message to express to people that we're doing a good job and we're flattening the curve. But also to say, I need you to continue to mask up, because the natural human reaction often is, oh, well, things are getting better. I don't need to take the precautions that I've already been taking. That's not correct. And I've said this, I'm going to say this again and again and again and again. This is not a sprint, it's a marathon. We have transitioned out of the type of restrictions that we had on the front end of this pandemic so that people can enjoy a greater degree of freedom, a greater degree of economic opportunity, the ability to actually go out and do certain things. At first, everyone was having to shelter in place. Now we have different regulations that are allowing, we're keeping our medically fragile and our elderly continue to be sheltered in place, and other people are going back to work. But if we don't continue to do the things such as social distancing, washing our hands, masking up, we can experience a secondary spike in this community that can create the exact same type of environment that we had when we were at the very beginning. And so this is not a sprint, it's a marathon. It is a test of diligence, it is a test of discipline, and it is a test of our ability to educate ourselves, for us all to act in a way that is most mindful and considerate, not only for our own families and loved ones, but for our fellow neighbors, strangers, citizens, people that we run into in the community, and other folks that come into this community. Again, testing continues at the Department of Public Health, and I'm pleased to hear that the Department of Public Health is going to be opening up a new testing facility. I believe that's going to start next week, and we're going to get additional information regarding that. Dr. Ruiz is going to be here today, along with 2 other team members, to provide additional information to the community about developments that have been made. We're very thankful for the fact that he has, as part of his team, or the Department of Public Health team, contact tracers that are continuing to work to identify those people that have been infected and the people that they have come into contact with so that they can best be protected. That's important from a variety of standpoints, not just from the perspective of letting people know that they need to stay in place and preventing further infection, but also in terms of identifying more and more people that do have the virus so that they can be more cognizant of whether or not they need early intervention with respect to their medical treatment. We know that people that receive earlier intervention with respect to their medical treatment of the COVID-19 virus have a greater chance of surviving the overall experience and not succumbing to it. And why that's very important, and we know that these things are true because we have seen the death rate drastically slow. Again, I want to remind everyone, if you are asymptomatic, get tested. It doesn't matter if you're symptomatic or not. We're one of the few communities in the entire state of Georgia where everybody can get tested. We need that to happen. We know that our surrounding counties have not been tested as aggressively as us, and they have access to this as well. The more data that we can get, the better we can express our needs, and the more likely we are to be able to fashion a sophisticated response as we emerge from this. Additionally, I want to acknowledge this. We have, in addition to the loss of life, in addition to the tremendous anxiety, the healthcare issues that we've had to suffer in this community, and that we are overcoming, we've also had a significant economic impact. I get calls all the time from people that have lost their jobs. They've lost their economic opportunities. We're having to have food drives across the community. The school system's literally been delivering meals to the different children in the community who haven't been able to attend school so that we can make sure that those who are food insecure can get food. Like, that's a real reality. Additionally, we know, and there's national statistics out there to support this as well, that the number of people that have been seeking medical treatment for things other than COVID-19 has drastically reduced. And so I want everyone to think about that for a second. you have so many people that have other illnesses, other medical conditions for which they're not getting treatment. And we know that early detection of things like cancer or kidney disease or things like that, that affects their survival rate as well. And it's very easy for us to become micro-focused on one thing, that being COVID-19. But in reality, the clock keeps on ticking on time, and we still have other thoughts, other issues, other medical conditions that continue to plague the community as in any sort of environment. And we have to be able to approach a standard way of life where everyone can feel comfortable and confident in being able to get the medical treatment, being able to return back to work in an environment where things are safe. And so I again, and I say this, I was on a phone conference earlier today with members of a White House team talking about some of the remedies that are going to have to be applied here in this community. We are aggressively pursuing additional PPP funding here in this community. And I want to encourage our small businesses that employ those, many of which literally live on the razor's edge of being able to pay for the food for their family and not. I want to encourage those small businesses and other businesses and other community partners, the people that help, the businesses that help people put food on the table, to continue to look at the resources that are available, look to the SBA programs that are available. We're going to be working directly with SBA and some of the other members that were made available to us through a White House phone conference earlier this afternoon. And we're going to be aggressively getting that information out there because we know that these resources directly impact how our citizens, our job holders, our job creators literally are able to provide for our community. And so I want everyone to please be on the lookout for that. Don't be too proud to apply for federal assistance. There are some very good programs out there that are designed to let people and their businesses continue to stay afloat. That's very, very important. And again, I want to applaud our citizens and our businesses for working hard to find one to think outside of the box. Like I've seen so many people that have worked very hard to teleconference as opposed to appearing in person. I've seen the people that have businesses where they work directly with people, where they're wearing very aggressive personal protective equipment. They're doing things like sanitizing again and again and again. There are, in fact, certain businesses in this community have literally been going through a process to get certified and to certify their employees in a manner in which they can best serve the public. We're going to have to continue to do that in this community as we try to move forward and emerge from this as a stronger, better Dougherty County. Thank you.
Thank you, Mr. Chairman, for your comments today. We will now hear updates from Phoebe Putney Memorial Hospital. Dr. Stephen Kitchen is the Chief Medical Officer for Phoebe Putney. Dr. Kitchen.
Thanks, Chief. I'll provide an update on behalf of Phoebe Putney Memorial Hospital in Albany, as well as our system at large. And fortunately, many of the favorable trends that we have observed over the last few weeks continue at this point. And there are a couple of key things, key statistics that we look at. One is the total number of COVID positive patients that are in our hospital at Phoebe and Albany and in our health system at large. And the slide that has the blue and orange graph basically shows that. And I will tell you, when we were in the midst of the local COVID crisis here, we had just over 160 COVID positive patients here at Phoebe Putney Memorial in Albany, and just over 180 patients in our health system. And I will tell you, compared to other communities and compared to other hospitals, that really does represent a huge influx on a per capita basis. And what I mean by that, for the population in Albany, that put us right at the top nationwide, with the exception of the metropolitan New York City, of having more patients hospitalized per capita than virtually any other municipality in the United States. And even compared to very large academic medical centers in major metropolitan cities such as Atlanta, San Francisco, that sort of thing, we really had a very large number of COVID-19 patients that we were caring for at that time. And fortunately, over the last several weeks, that number has steadily declined. So today at Phoebe Putney in Albany, that number has declined from a peak of 160 to 52. And I think 62 for our health system at large. One of the things I personally watch most closely are what's the number of patients admitted every day to Phoebe Putney. And that number has also steadily declined, and that number is represented by the graph that you see new patients hospitalized for COVID-19. And if you look at Phoebe in Albany, you see that that number has steadily and sharply declined. And that number peaked out somewhere in the mid-40s, and we have been operating in single digits for well over a week now. So when I look at the last week, that number has ranged anywhere from a maximum of 6, fortunately, down to 1, which is we only had 1 patient admitted with COVID-19 over the last 24 hours at Phoebe Putney. The other thing I'm very encouraged by is that if you look at those number of admissions that we have every day, the number of patients that are requiring ICU care has significantly declined as well. And although there could be several reasons at play for that, I do think it has something to do with there's a much greater recognition in our community of the signs and symptoms that go along with COVID-19. And fortunately, I think people are seeking medical care much earlier in the course of disease, and we fully believe that the earlier in the course of disease that we're able to treat patients with COVID-19, certainly the chances of having a favorable outcome will increase with that as well. As far as the number of deaths, and I think you've heard Chairman Cohilas speak to the fact, as well as Michael Fowler, our coroner, that the number of deaths has also declined. Unfortunately, we still see deaths. I will tell you, by far and away, the vast majority of deaths that we're seeing at this point, unfortunately, are those patients who have been hospitalized in the intensive care unit for a prolonged period of time, usually 3-4 weeks or longer, and have required mechanical ventilation for a prolonged period of time. And we unfortunately know that's the group of patients who are at highest risk for not being able to recover from this devastating illness. On the flip side, we're also very encouraged by the fact that we're seeing more and more patients who are successfully being able to come off of the ventilator and be what we refer to as successfully extubated, meaning that their breathing tube is removed and they're able to successfully come off the ventilator at that point. And I tell you, I just, again, can't say enough about our frontline staff, the physicians, the nurses, the respiratory therapist, and everyone who is involved in their care, because I think we have certainly, our management of this illness, particularly in the ICUs, has progressively advanced, and I certainly think that the favorable trend that we're seeing in clinical outcomes is due to the unwavering commitment of all of our frontline staff. I do want to speak to the fact that, going forward at this point, yes, we have many, many favorable trends, but I think the reason we have observed this is because, again, of those very effective public health measures that have been put into place, and that the citizens of our community, the personal responsibility that they have exercised in practicing those things that we know time and time again that have been shown to be effective in reducing the chances of exposure, in reducing the chances of transmission, in reducing the chances of becoming infected with COVID-19. So again, I think the 5 things, I really think everyone has a personal responsibility to do. Wear a mask when you're out wear a mask when you're out in public. Practice hand hygiene. Wash your hands frequently. Avoid touching your face. It's very easy for you to transmit the virus that way. Continue social distancing, maintain 6 feet apart, and continue to frequently clean and disinfect surfaces that may be infected with the virus as well. Because I think if we continue to practice these things on an ongoing basis, we'll be able to resume some of the activities that everybody wants to do at this point. But I do think if we become nonchalant or cavalier about this, it's only a matter of time until we, unfortunately, see that trend go in the wrong direction. And one of the things that makes it most challenging is what we have learned as our understanding of coronavirus has increased, is that unfortunately we see a lot of what we call asymptomatic transmission. What that is that people who are carrying the virus unknowingly, they're experiencing no symptoms whatsoever, but yet they're fully capable of inadvertently transmitting the virus to family, friends, and anyone out in the community. That's why frequent testing is so important. I think we've seen the impact of that in our community. And what we have observed, it is not unusual, it is not uncommon for someone to be tested who is having no symptoms at all, and they end up being positive for COVID-19. Well, first of all, that increases our understanding of what the transmission pattern is like, and we can trace contacts and that sort of thing. But more importantly, it allows that person to self-isolate that time, which dramatically reduces the chances of unknowingly transmitting that virus to other people in the community. So although I'm certainly encouraged by the trends that we have seen, my request and my petition to everyone is to continue to practice those measures that we know have been shown time and time to be effective. So thank you again.
Thank you, Dr. Kitchen, for your update today. We will now have an update from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz, and Dr. Ruiz also has some guests with him today, and he'll be announcing those during his presentation. Dr. Ruiz.
Thank you, Chief Scott, and good afternoon, everyone. I want to start today by talking about an observation that a very astute individual made recently regarding the data that we post in public health on a daily basis. It can be found on our Southwest Georgia Public Health webpage, and it includes a daily update of the number of cases of COVID-19 per county in the 14-county Southwest Georgia Health District, and it also includes an update on the number of deaths per county. And so every day we add, it's a cumulative number that represents what we have added overnight. So someone noticed that between May the 12th and May the 13th, there was an increase in 33 cases for Dougherty County. And that number is a little higher than normal. Typically, it goes up around 10 or 15 overnight. And so he noticed that this was a higher number, and a question came in asking for an explanation. And so I want to point out that information that gets posted every day is not truly real-time information. It's information that we get on a daily basis that oftentimes tells us what might have happened 2 days ago, or even as many as 5 or 6 or 7 days ago. And the reason for that primarily is because most places that test for coronavirus, for COVID-19 virus, are not able to provide immediate results. The reference labs that are used primarily to test Georgians, those reference labs are pretty much up to their capacity. And although we would like to get results right away or within 24 hours, in most cases, reference labs produce results between 2 and 7 days. We're constantly trying to find ways to shorten that period of time. And then because we're encouraging more people to get tests, and because many people are getting tests, that further puts the labs behind. But don't let that be a deterrent. We still want you to get tested, and we're going to turn around those results as quickly as we can. Another thing that happens from time to time is much of this information is reported to public health electronically. And we all know that sometimes technology doesn't always work in our favor, and there can be a glitch here and there. So the flow of information, while I've already said that it's sometimes just delayed by its nature, occasionally there can be a little glitch electronically, and that can slow information down, and then it might appear that something has happened that's actually worse than it appears to be. With that being said, I will say that when I got this question, I went back and I looked over the events of last week. And it was interesting, on May the 5th and May the 6th, there was a slight uptick in some of the patients that were tested in Dougherty County. We had about 10 or 12 more cases during that period of time than we normally would. And so that combined with the fact that our information is delayed, and we had a little electronic glitch that was straightened out this past Friday and Monday, I think that accounted for what appeared to be an uptick, but that trend came right back down, and so we're still moving in the right direction. But that was a very astute observation that someone had asked a question about. Overall, the health of the communities overall seems to be getting better. With that being said, I do want to mention a sort of isolated area where we have seen a little bit of an uptick, and that is in Mitchell County. This was realized over about the past week or so. A few more cases than normal in Mitchell County. And it turns out that the cases that I'm referring to, about 20 or 25 people, and those folks have already come off of isolation, and the vast majority of them have gone back to work. I'm not aware of anyone in this group that was hospitalized. Public Health has interviewed all of these folks, and we have obtained a list of their contacts. We have been in touch with the contacts and advised them on quarantining. So it's a situation that appears to be in very good control. However, I mention it because we want to urge everyone to be tested, but particularly those folks in Mitchell County. We'd especially urge you to get tested, and it's an easy thing to do. This afternoon, collections are being taken at the First Baptist Church on East Broad Street in Camilla. We would prefer, if someone wants to be tested, to call the number 229-352-6567 and make an appointment for this afternoon. But if that's just not a convenient thing to do, you can simply just go to the First Baptist Church in downtown Camilla and get tested. They are there now, and they will be there for several more hours. If you missed this afternoon's opportunity, they will be back at the church this Sunday morning between 9 and 12 for testing in Camilla, Georgia. And again, that number to call is 229-352-6567. We're also happy to announce that in Thomas County, there will be an opportunity for people to get tested in a location other than the health department. This Saturday in Thomasville, Georgia, at the Disciple of Jesus Ministries, 228 Augusta Avenue, testing will be conducted between 9 a.m. and noon this Saturday in Thomasville. Again, we would prefer that you call, make an appointment, 352-6567. But if you can't do that for some reason, we will still do our best to work you in and get you tested. People can go to this location in their automobiles and have drive-through testing, or a person can walk through and get tested there in Thomasville at the Disciple of Jesus Ministries Church between 9 and 12 this Saturday. And this week we have collections going on in Decatur County Monday through Thursday, and Dougherty County Monday through, actually in Dougherty County Monday through Saturday, but we're going to go into the details about that in just a little bit. Grady County Tuesday and Friday of this week. Terrell County Wednesday and Saturday. And I've already mentioned Thomas County at the Health Department Monday through Friday, and then at the church on Saturday. I want to switch and follow up just a little bit on something that Mr. Cahilas talked about, and that is the effects of the COVID virus on children. All along we have been saying that serious manifestations in children is pretty unusual, but we certainly cannot say that it doesn't exist. Some children do become sick. some children become seriously ill, and on rare occasions there have been children who have lost their lives from COVID-19. Typically, when we think about the effects of COVID-19, we think of severe respiratory problems that cause issues with getting oxygen into the bloodstream. We talk about people being on ventilators and so forth. But it's now being recognized that in some cases, days, if not weeks after an infection, there can be quite a violent reaction of the immune system that can cause problems in different parts of the body. And there have been children, in rare cases, who have had issues like this. It's being referred to now as a multi-system inflammatory syndrome. And typically, this is not really a respiratory issue. It's not so much of a problem with pneumonia or the lungs themselves. It can affect other body parts, other organs. And it is suspected that the charged up immune system may be doing some damage to the body. We don't know near enough about this, and as time goes on, studies will be conducted and we will learn more about it. But for the time being, the important thing, I believe, is to recognize that children of all ages can be affected by the COVID-19 virus. So if a child has an unexplained fever, significant changes in their behavior or their appetite, if they have red, inflamed eyes or cracked lips, those are children that need medical attention pretty quickly. Now, there are other conditions besides COVID-19 that can cause this list of signs and symptoms, but just be on the alert that children having any of these kind of problems need professional attention right away, and it would be a great idea to contact their pediatrician, or if the illness appears to be severe, to have the child seen in the emergency room. Today, I would like to introduce two of my colleagues who will come and talk to you about issues that are related to the response to COVID-19 and also to the normalization, the gradual normalization of activities in the community. And so I'm going to invite Mr. Clay Poole to come up and talk. Mr. Poole is the Director for Environmental Health Services throughout the 14-county Southwest Georgia Health District. And he's going to speak just a little bit, I think, about restaurants, and perhaps he'll touch a little bit on public pools. And after he concludes, he will be followed by Vamela Lovett. Ms. Lovett is the county nurse manager for the Daugherty County Health Department, and she's going to talk a little bit about outreach into the community and some access to testing sites here in Daugherty County. Thank you.
Good afternoon. My name is Clay Poole. I'm the District Environmental Health Director for District 8-2, and I want to kind of give a little bit of update on the executive order that the governor passed on the 12th that kind of eased more of the restrictions for food service facilities. Previously, food service facilities were allowed to open their dining rooms and have a maximum of 10 people per 500 square feet, and the party size was limited to 6. Now that the new executive order has gone into effect, it is relaxed that a little bit, and you can now have 10 per 300 square feet of dining space and a party size of up to 10. And this will go through May 31st. That's when it expires, and we'll see if there's any more guidance that comes with the expiration of that. And also with the new executive order, we have swimming pools that are public, such as hotels and motels, apartment complexes, and your YMCAs. They are allowed to be permitted and open to the public. There are still restrictions, guidelines that they have to follow in order to remain open. So we'll be working with all of our pool operators to get them open as quickly as possible. That does not mean any water parks or spas that are related to fitness centers. They are not allowed to open. And that's about it. Anything else?
I'm Pamela Lovett, the County Nurse Manager for Dougherty County, and I'm going to speak briefly about some community outreach that we are planning. As you know, we've been testing at the Dougherty County Health Department from Monday through Saturday. Monday through Friday, we test from 8:30 to 3, and then on Saturday from 9 to 12. However, we've seen the need to go further into the community to test those individuals who may not have access to travel to the location at the health department. So beginning this Saturday, May 16th, we will have what we call a pop-up spot, which is a specimen point of collection. It will be held at the New Jerusalem Pentecostal Church located at 2117 South Madison Street. This will be a drive-through clinic. Also, we will provide services for those who walk up to the clinic. This will be from 9 a.m. to 12 noon Saturday. Also, in the plans is a pop-up spot for Saturday, May 23rd at Robert Harvey Elementary School. That's located in East Albany. It's the old Jackson Heights School. It's located at 1305 East 2nd Avenue. This clinic will be held from 9 a.m. to 12 noon. That's on May 23rd. This will afford those who may not be able to come to 1710 South Slappy for testing. They can go to those sites. And it's open for all community residents here and even from other counties to come here to get tested. As we move forward, we will continuously assess the needs here in our community in planning future pop-up spots. Thank you.
Thank you, Dr. Ruiz and your team today. Very, very good updates today and exciting news to get those pop-up spots in our community. So thank you very much for that report today. We will move now to a report from our Dougherty County Coroner, Mr. Michael Fowler. Mr. Coroner.
Good evening. Today we're going to change up a little bit. We're going to be doing our graphs from now on Tuesday because some of the numbers that the death rate have slowed down. We just had one more death, so we had 131. So during 1 week we was up to 29 deaths. Now we're down to 1 or 2 a week. So instead of repeating the same numbers over and over again from Tuesday and Thursday, so I will do the graphs on Thursdays and I'll just give you the count on Thursdays. So again, like we had 131 and we have 102 Afro-America. So that's where we at now. Thank God that we're coming down, like the chairman said. If we keep doing what we're doing, we will beat this thing. We got to do it together, wear masks. I don't want to repeat everything that everyone has said, but wearing masks, wash your hands, and practice social distancing. So we have come down a lot. I know EMS is not running with a lot of the COVID cases we had. I mean, we was running for a while, but thank God things are slowing down now. So let's keep doing what we're doing, and I think it's going to work. Thank you.
Thank you, Mr. Coroner. Actually all of our presenters are still here today, and we'll open up for any questions that need to be addressed. Any questions? Okay. Well, today we will remind you again of the number to the Emergency Operations Center. It is 229-302-1900. If you've missed any of the information today, please call the EOC and we'll be happy to route you in the direction of those resources. Again, if you're planning a food drive as well, we want to encourage you to call the Emergency Operations Center. If you're planning to have a food drive or disperse food, we ask you to call and coordinate that with the Emergency Operations Center as well. As always, we want to encourage you to mask up Albany, mask up Dougherty County, and we will see you again on Tuesday at 1 p.m. That concludes our press conference.